When your house is on fire, you call for a fire truck. When someone is injured, you call for an ambulance. When you're having a mental health crisis, do you know who to call? Today, I sat down with the Crisis Response Unit of the Jonesboro Police Department to see how and why they do what they do. It's new at 10.
For that day that may be the darkest day of their life for them, I want them to know that tomorrow we will be there for them as well.
Trisha Craig is a mental health professional with Arissa Health. On any given day, she could be a co-responder with either officers Rachel Griffin or Rayana Thomas. They respond to any crisis calls that JPD gets, but they're taking it a step further.
Trisha and I are actually instructors. Okay. So we teach the crisis intervention training. Yeah. And it's something now that anybody who comes through JPD, anybody who comes to their academy comes through our CIT class.
Because of that, JPD has the most crisis intervention trained officers in Arkansas. Being the second largest and fifth most populated city in Arkansas, they feel that's an important resource to have.
Just the aspect of being a team, like you're not going at it alone. You know, there's officers you can call, other instructors, mental health professionals. You know, any kind of question you've got to ask, no one's going to judge you. We're all interested in the same goal.
The goal is to combat mental health. For CIT officer Rayana Thomas, it's personal. She said it's about giving back to the community that's given so much to her.
I saw that there were a lot of people that felt like they were alone, that nobody cared, that nobody understood. So empathy is a big thing with me, and I wanted people in this community to see the empathy that I have, because this community has been good to me since I moved here in 2008.
Mental health is consistently criminalized in many communities around the country. The Crisis Response Unit wants people to get away from that stigma.
There's just so much going on in their mind. And for me, I recognize that. While an officer that is not trained may think this person is just not cooperating.
That only amplifies the necessity of having every officer trained in crisis intervention.
With all the trained officers, they're kind of recognizing more so like, hey, this is a person in crisis. This may not be what we got called out there for.
Awareness is key when it comes to mental health. Sherry Adams wants crisis response to grow into a preventative measure and beyond just a responsive one.
Before things get totally maybe out of hand for somebody or out of their control, we want them to feel like they can keep themselves and keep their situation in control, and we're here to help them try to do that.
The team wants to assure people they're not just prevention and response, they continue to follow up too.
It's not always everybody's best day when you call the police, you know, and we accept that. You know, whenever that person may be hospitalized, you know, for their mental health, it's important for us to go back and check on the families.
Sherry Adams said they see the impact they have on the community and want it to continue to grow.
They will call dispatch and they will ask for a certain CIT officer, or they will ask for a CIT officer. So that means a lot when your community can say, you know what, I trust you, and I'm going to call you, and I know you've helped me and my family or helped me before, so can you come and help us again?
The Crisis Response Unit is looking to grow to have officers available during all shifts at the Jonesboro Police Department. If you or someone you know is struggling with a mental health crisis, don't hesitate to call 988 or JPD Dispatch at 870-935-5551. For more resources concerning mental health, visit this story on KAIT8.com.